Good morning. I'd like to welcome everyone back to our fifth show of Out of the Box. If you've been following our show for the past 6 or 8 weeks, you know we started with a anxiety and depression show, which I think went over very, very well. And then we followed that up with the detoxification show. I think we got a lot of information out there. I've been getting a lot of calls on detoxification and how to detoxify effectively. Then the last 3 weeks we've been doing actually weight loss and how it's actually not calories in and calories out anymore. And I know there's going to be a lot of people who disagree with this. I just got in a conversation with an MD the other day, and they're like, "Oh no, 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 no! You know, weight loss is calories in, calories out. If you reduce your caloric intake and increase your caloric outtake, you're going to lose weight. No questions about it." Well, maybe that was true in the 1980s, and I wanted to respect the man, and I didn't want to kind of get in an argument with them, but that's not the case anymore. As we've been talking about the past three weeks, we know that it's a combination of hormones that get messed up in the body because of many different reasons. Our diet, processed foods, all the different things in terms of stress, lack of sleep, all these different things affect our hormones, and our hormones actually, build our organ structure. And there's a lot of different things that go on with health benefits in terms of working with hormones within the body. We're going to go over a couple of new ones today. Now, to recap a little bit, remember what we did the first one. We did insulin. And remember, insulin, if it goes high, that means there's a high glucose running around in your bloodstream. And if your body is insulin resistant, the insulin is not going to get into the cell. Insulin is going to take the glucose to the liver. It's going to be converted into fat, and that's how you get fatty liver. So you can cut down on all the fat you want in your diet, but if you're eating high carbs, refined sugars, it's still going to turn into fat. So that's the first hormone we talked about is insulin. The second hormone we talked about was cortisol, the stress hormone. And the stress hormone basically is one of those flight-or-flight hormones that when you get stressed, you're going to get again, what we just said, a fight-or-flight syndrome, where the body has to tense up and it's going to stay in fight, or it's going to run away. But either or, you have to start generating more gluconeogenesis, which is actually the production of glucose for the cells to utilize glucose as energy. Your heart rate increases, your your arteries and your veins vasodilate, which means they get bigger, they get more blood flow into the area. You become more mentally acute, adrenaline kicks in. But the problem with that is that the body thinks that it actually has had this 3 or 4 mile run, but it hasn't. And so nothing has calorically actually changed. So the body thinks, okay, I've burned through all this calories. So what do you think it does? It thinks it has to eat more calories because it thinks it actually burned those calories, but it didn't. So cortisol, the stress hormone, will actually increase weight loss also. Then we went into two other hormones, I think last week maybe. And we started with leptin, which is a hormone that's actually produced in your fat cells, your adipose cells. So the more fat cells you have, the more leptin you produce. And leptin is supposed to tell the hypothalamus, part of the brain, that I've had enough. No more eating, I'm satiated, I'm satisfied, and we should be fine. The problem is, again, we're going to go over the different reasons why weight loss is challenging. But one of the things that we go through is our bodies are toxic, and our bodies are toxic, and they interfere with cellular degeneration, cellular energy metabolism, the citric acid cycle, DNA, mitochondrial function, all these different things that we get into in terms of leptin resistance, which just cannot control our appetite. So leptin is saying, hey, we've had enough to eat, don't eat anymore. And when leptin isn't working properly, the hypothalamus isn't getting that signal, and then you keep eating and eating and eating. And the fourth hormone we went over was ghrelin, which is produced by your stomach, and that's a hormone that tells you to eat and eat and eat. So basically, because of our intestinal dysbiosis, bad bacteria, good bacteria, inflammation, all the different things that go on. Again, we went over all this. So this is a brief little recap of the previous hormones. And then ghrelin is going to come out of the stomach and tell the body to eat and eat and eat. And if the body isn't sensitive to the negative feedback systems, that's what you're going to do. You're going to eat and eat and eat, and then you have now these four hormones that are working up against you to maintain weight gain and not lose any weight. So we just have those four hormones to deal with. Okay, now we have two other hormones that we're going to throw into the mix, and I'm sure you've heard of this. I'm sure you've heard of estrogen and testosterone. It's amazing that estrogen and testosterone I can't remember. We're going to go over estrogen and testosterone today, and not in depth because it can get a little bit complicated. But we're going to go over the highlights: how estrogen in women and men can affect weight loss, and how testosterone in men and women, mostly in men, can affect weight loss also. So again, when I work with people, and I see many people a week in terms of their nutrition, whether it's dealing with weight loss, cardiovascular disease, diabetes, cancer, autoimmune illnesses, GI problems. One of the things I always do when they come in and they've been on these programs, I always ask them, okay, they lost 15 pounds. And I'll always say, 15 pounds of what? And if they tell me, well, they don't know, that means nothing to me. Because that 15 pounds of weight loss could be 15 pounds of muscle tissue. So now what you've done is you've lost 15 pounds of muscle tissue, you've lowered your BMR, your basal metabolic rate, so your metabolic rate goes down, and so you're burning less calories and you're actually intaking more calories, so again, you're going to put on weight. So again, it all depends on the hormonal makeup, and so this is again something why we look at hormones as a contributing factor, a very important contributing factor to weight gain or adverse weight loss. So today we're going to talk a little bit about estrogen and testosterone. Again, a little bit more review. Again, one of the reasons why we have such difficulty in weight loss, you can see the toxic environment in the liver. The liver is not detoxing. If the liver is not detoxifying, it's not getting impurities out of the body. The impurities go into fat cells, and because most toxins are fat soluble, so the body has to get them out of the fat, out of the bloodstream. So what's it do? It puts them into fat cells. And they're kind of happy there, so they kind of make up their home. They cook little campfires and they kind of hang out there and cook their weenies over the fire, and everyone is happy. But at some point, this is causing problems because toxins are toxins and they're dangerous. And you have to get the toxins out of there, and so that's one of the problems that we need to do is actually look at getting the toxins out of the liver and out of the fat cells. GI dysfunction, what we talked about. If your GI is not working properly, you're going to gain weight. Again, we talked about that with inflammation coming from the intestinal tract, whether it's a condition called dysbiosis, which just means dysbiosis, life, which means you have an altered life in your intestinal tract, which means that you probably have too much bad bacteria, not enough good bacteria, and that's going to create a whole set of problems also. So that's another thing that we look at is how healthy your intestinal tract is. Inflammatory conditions. We are loaded with inflammatory markers. We just cannot get through our society without having a tremendous amount of inflammation in our body. And again, I'm not talking about the little redness on the skin that most people get, and they come in and say, well, I have a little redness on the skin. It could be, a skin problem. It could be psoriasis, eczema, things like that. We're talking about significant inflammatory markers that are actually in the body that's causing tissue destruction, causing other hormone imbalances, and we kind of have to get those inflammatory markers under control too. So that's another way that we can look at things. Obviously, thyroid disorders. So when we look at, a lot of people had come in and say they have thyroid disorders, hypothyroid, Hashimoto's, all these different things. And there's a pathway called the hypothalamic pituitary thalamic pathway. And that's something that can be really messed up. And it's not to say that the thyroid is a problem. It could be something upstream that's a problem. And you fix that, and the thyroid comes right back into line. So again, we can look at nutritional deficiencies, essential fatty acids, which we've talked about, and of course, you always stand by calories in, calories out. And I'm not saying that's important because obviously people who eat 5,000 calories a day but only exercise 1,000 calories a day, they're going to put on weight. But that's not where the science is going. The science is going more towards hormonal control, which we talked about our first four segments. So again, what we're going to talk about today is looking at more hormonal balance and trying to maintain all these hormones and get them into balance, or getting them into sync. And the body wants to look for balance. The body does not want to look for things happening at a higher level here and at a higher level there. It's called homeostasis. And the body always wants to be in homeostasis, and that's what we're trying to do, is figure out why the body is not working properly and why certain aspects of the body is not in homeostasis, causing all these different issues, which again can have problems on hormonal control of many different aspects of the body. But we're talking today about weight loss, and then as it goes back to the old standard, inflammation. And inflammation, you have seen me do this in every slide. We all have it. We all have high inflammatory markers. I think we talked about that every baby is born with 280 toxins in the body. Imagine the inflammation that's been going on in that body for a long, long time. So we have to work on the inflammatory aspects of weight loss also. And again, this is where I come in terms of putting the whole program together through subjective data, questionnaires, possibly some blood tests, a few other things. We kind of get a better idea of what's going on, and a little bit more individualized for my patients. And we work with them for 12 weeks. We go over everything. We try to analyze everything and go over what's working, what's not working. The analogy that I use with my patients: if a plane is taking off from New York and it's going to land in LA, well, that plane 90% of the time is off course. You have winds blowing it here, you have winds blowing it there, you have air traffic controllers saying, hey, you need to bypass the storm. It's telling you to go higher, it's telling you to go lower. But guess what? In the end, a plane that's taken off from New York lands on this tiny little runway, 3,000 miles away, but with lots of different little guidances along the way. And that's what I do. I go in there and we work together, and we actually do these little guidances to kind of figure out what's going wrong and what we can do more appropriately to have the best results that you possibly can with your weight loss as it relates to hormonal control. So what we're going to do is talk about now is the two male and female hormones, estrogen. Again, we talked about the estrogen, we talked about the insulin, the cortisol, the ghrelin, the leptin, and those are very important hormones. There's no doubt about it. And the last two we're going to talk about, like I said, is estrogen, which is, we know it's the predominantly female hormone. And we're going to talk about testosterone, which is a predominantly male hormone. And so let's talk about, there's not a lot of information here. So this actually, we may keep this under a half hour. And I know, Todd, if I keep it under a half hour, you hear this probably screaming in the background, and I finally kept something under a half hour, because I tend to ramble and talk, and we tend to have to do these in 50 minutes, and he has to work and cut them off up into two different sections. So we're hoping we can get this done in about a half hour, but I'm not making any promises. You can blame my parents for that, okay? Because I don't know what happened, but I ended up just talking far more than I should. But we'll see what we can do. So the first thing we're going to look at is estrogen. Okay, again, the dominant female sex hormone. All right, so estrogen balance is essential for achieving and maintaining fat loss. Estrogen, just like any other hormone, has to be in balance. If it's out of balance, it's going to cause problems. One of the things it can cause is increased weight gain, increased fat gain, fatigue, central obesity. But one of the problems that happens is that, in a basically a premenopausal woman, too much estrogen is a condition called estrogen dominance. And what this is that in premenopausal women or younger men, estrogen starts. There's a lot of different things that affect estrogen. We're going to talk about that. Different xenoestrogens that come from the outside, or different estrogens that are formed on the inside. And what happens is that this unfortunately affects fat and affects weight gain. So when you're what's called estrogen dominant, you have too much estrogen in your body in relationship to progesterone. So the estrogen is like the female dominant hormone, and progesterone is very important too. But again, you should have a balance. And again, all we're talking about is balance of hormones. But when estrogen gets way out of balance and progesterone goes way down, you're going to have a problem. And that's one of the problems is weight gain, or difficulty losing weight. So we have to work with the estrogen. We have to work with the progesterone, especially when it comes to females. So that's one of the things that we're going to talk about. So actually, I'm going to go back here if I can. Okay, so in men in premenopausal women, too much estrogen, again, called estrogen dominance, and estrogen dominance will lead to weight gain. It will lead to fatigue, bloating, and other health and wellness issues. Now, a woman's age, that there is natural decline in testosterone, and just like men, women will decrease their testosterone level. All right, testosterone is the muscle-building hormone found in males and females. And I always get this all the time from women who come in and they talk about their husbands, and they go on a diet at the same time, and within 2 weeks, the gentleman has lost 7 pounds and the woman has lost 1 pound. And a lot of it has to do with the man having more testosterone, which is going to burn fat at a higher rate and is going to put on more muscle tissue. And women don't have the testosterone as much, so they get very frustrated because they're doing everything that their husband or their significant other is doing. But weight loss isn't just coming off, but it's kind of melting off for the guy, because he has his testosterone imbalance, and it's a lot easier to lose weight when your testosterone is in balance. But again, we have to balance out estrogen, progesterone, and testosterone in women also, or else you're going to be all over the place and you're not going to lose weight. We have to get these hormones in balance, not only for men, but for women too. So while premenopausal women with too much estrogen tend to have pear-shaped body, and what that means is that if you have too much estrogen, the estrogen tends to deposit fat and down in your hips and your waist and your buttocks. So you have this pear-shaped body. All the fat is kind of lower into the body, and that's kind of an indication of estrogen resistance right there. So that's something we can look at and start working with people on. If we can look at their body type, we kind of know what's going on with their estrogen dominance, and how to kind of work with that just based on body type. Other estrogen issues, more people will come in with apple shape, which meaning they're putting their weight in their core, in their abdomen. And that's actually a little more dangerous because the fat is actually accumulating in the abdominal area, and it's called the visceral fat, and that's the most dangerous fat that you can have. So again, we look at many different things. Again, it's not calories in and calories out. We've gone over the 6 other hormones that have an effect on that, and now we're looking at estrogen and testosterone level that can definitely have an effect on weight loss and weight gain also. So both men and women with excess estrogen exhibit an apple shape with more fat accumulation in the abdominal area, and we just talked about that. If it's in the abdomen area, then we actually know that's an apple shape, and we can kind of take it from there, knowing what the estrogen levels are. So kind of recap that a little bit. Estrogen plays a huge role in what's called estrogen dominant, which is much more estrogen than progesterone, and estrogen decreases testosterone levels, so you're not building muscle tissue, and it has a lot of other issues. So if you're estrogen dominant, you're going to have a lot of problems. Again, this is where I come in and we come in, where we can actually measure your estrogens and see if you are estrogen dominant, and kind of work a little bit more from there, because we have a little bit better piece of the puzzle. So we can do blood tests, questionnaires, things like that, but it's going to be nice to know exactly what we're dealing with. So if you're estrogen dominant, you probably should see someone like me or someone else who knows what they're doing to kind of find out, are you estrogen dominant? How much are you estrogen dominant? Where are your testosterone levels? Where are the progesterone levels? Where is the fat being accumulated on the body? Do you have fatigue? Do you have headaches? Do you have other symptoms that are going on? That can all be related to some of the things that we're talking about. So again, it's not calories in. You're probably sick of me saying this, but it's not calories in, calories out. It's a part of the problem, but hormones are definitely far more of a problem than calories in, calories out. So when we go to the next slide, there are only two ways to accumulate excess estrogen in the body. Number one is that we make too much. Okay, a genetic issue. That there are some women, some men who just make a lot of estrogen. Their DNA is geared up to make a lot of estrogen, in their body, and that's not a bad thing. I mean, that's not a good thing because too much estrogen is going to cause problems. The number one factor for women developing breast cancer at a later life is lifelong exposure to estrogen. And let's face it, we all know. If you're not at that age where you have 8, 9, 10-year-old girls, little girls are going through puberty at a much, much younger age because they're getting estrogen into their body. And I know we live in Vermont, and I know this is very cattle country, and this is dairy country, and I'm probably going to step on a few feet here, and I apologize. But most of the dairy that is produced have high levels of antibiotics, have high levels of growth hormone, have high levels of estrogen. A lot of the meat that the cows are injected with are estrogen and growth hormones. And so when you eat this meat and you drink this milk, you're getting estrogens in the body, and they're called xenoestrogens because they're coming from outside the body. And they mimic as estrogens, they work the same way as estrogens. So diet has a huge, huge relationship between how much estrogen you have in your body. You can try to clean out your body all you want, but then you go sit down and have a 12-ounce piece of meat, and then you have some soy, and then you have some dairy. Well, you're just putting that estrogen right into your body, and it's going to create that whole cycle again. All right, so meat, dairy, soy. Trying to stay away from, organic estrogen. Well, try to stay with organic, estrogen-free, antibiotic-free foods, which is much, much, much healthier for you. Dairy, the same thing. Meat, chicken. The more you can keep out of your foods in terms of the estrogen mimics, the better off you're going to be. Because like this, these mimics get into your body, and they fool your body thinking that you have all this estrogen, and you become estrogen dominant, and you have all these other problems. What we're going on is very, very similar. We're constantly exposed to estrogen-like compounds in foods that contain toxic pesticides. We know that. We know what we spray on our products and spray on our food supply are estrogen, xenoestrogens. They will affect the estrogens in the body. DDTs, PCBs, pesticides, growth hormone, estrogens that they pump right into the body, and that gets into us, and again, it causes a problem with estrogen dominance. And like I said, we see little girls now starting to go through puberty at a lot younger age. That's not a good thing, because again, I think I said the lifelong one of the biggest risk factors for developing cancer is a woman's lifelong exposure to estrogen. So if these little girls are developing estrogen at a much younger age, they're increasing their risk of breast cancer. Not only all the other things that we've talked about, but cancer. So again, everything is kind of related to what we're talking about. So one of the other things that is the pharmaceuticals. Okay, so when we go to hormone replacement therapy, you're loading your body with estrogens. Now, I think a couple of years they stopped making a lot of that, and so the estrogen is actually coming down, but there are still people who are on hormone replacement therapy getting lots of estrogen into their body. Then you combine that with meat that has estrogen, and vegetables that have pesticides, herbicides, fungicides that mimic estrogens, again, xenoestrogens, and we wonder why we have all these problems with weight problems with women who cannot lose weight because their estrogens are totally out of alignment. And it's making insulin resistance, which we talked about, It's causing insulin resistance where the body it can't recognize sugar, so it gets dumped into the fat, into the liver, converted into fat, and you have this whole cycle, this whole domino effect going. And at some point, we have to cut that cycle a little bit. And again, and that's kind of like what I do through a series of questionnaires, possibly some blood work, is find out where you are and what we can do, and kind of go from there. So, okay, so next, all right, estrogen. All this fake estrogen overwhelms your body's testosterone, which is vital for hormone balance. So basically, estrogen, as it gets higher and higher and higher, will overtake your testosterone level. And what you don't want to do is lose testosterone as we get older. But the higher the estrogen goes, the lower the progesterone goes, you're going to affect your testosterone level. And testosterone is a hormone, male hormone, but female has it too, that produces muscle tissue. The NIH came out many, many years ago and said that the number one reason for morbidity and mortality, mortality meaning death, morbidity meaning getting sick, is a condition called sarcopenia, which is basically a fancy term for muscle loss. And so the more muscle you can maintain throughout your life, the healthier you're going to be. So, with women, with men, the more levels of testosterone that you can keep in your body, the more muscle you're going to make, the stronger you're going to be, and the less problems that you're going to have. So estrogen and testosterone definitely play off of one another, but there are individual aspects of each hormone that will have an effect on one another also. Testosterone contributes to muscle growth, which supports metabolism. Already we know that, all right? Testosterone will increase muscle tissue. Muscle tissue is more metabolically active than fat tissue, so you can increase your metabolic rate. So the more muscle you put on, the more calories you're going to burn. I think the last stat is, I think a pound of muscle burns about 600 calories in the course of a day, and the average pound of fat burns about 200 calories a day. So would you rather have more fat, or would you rather have more muscle? Of course more muscle, because you're burning a lot more calories with muscle. So the more testosterone you have, the more muscle tissue, the better off you're going to be.